We are so honored today to have Houston's very own Dr. Baxter Montgomery. Dr. Montgomery is a board-certified cardiologist with years of experience in the latest medical practices and nutritional health. He is the founder and medical director of the Montgomery Heart and Wellness Health Center, where patients are introduced to a novel food prescription plan that helps reverse chronic conditions such as heart disease, hypertension, obesity, and diabetes without medications or surgeries. Dr. Montgomery has also created a docuseries, Heart and Soul of a Champion, to give us an inside look of the health journeys of individuals undergoing the life-changing experience of optimizing their health by switching to a whole food, plant-based, raw vegan diet. And guess what? We get to view the first episode of his series right here. I am also very proud to say that he is my cardiologist. So I'm very humbled and honored to introduce Dr. Baxter Montgomery. Thank you, Dr. Montgomery, for being with us here today.
Thank you. No, my pleasure, and thank you for having me. It's an honor being on, and I am. Let's see here. I want to make sure you can see my slide. I'm looking at it here. How are we doing? I think I have a green box around it.
Yes, yes, we can see it.
So what I want to do today, and again, thank you very much. It's an honor to be on a program that honors the legacy. Late Sunshine is one of my mentors and a treasure to the community. What I want to do is since it's a Saturday morning, I want to keep it somewhat informal. I have a brief presentation to give you to set the stage. But what I'd like to do is share some of the episodes of the docuseries, because the docuseries is a product. First of all, this is season one. There are 8 episodes in season one. We're currently working on season 2. And the purpose of the docuseries is to, what I like to say, pull back the curtains of our operations and share with the general public different people's stories in terms of how they are reversing chronic illnesses naturally. And we want to share with the world how people, have the courage to come and make fundamental changes in their life to conquer these chronic illnesses. So what I'd like to do is start off with this concept of integrative health adjustments. But the concept of integrative health is one that we've recently coined to express or define what we're doing in our operations. As a cardiologist, being in private practice for more than 25 years, I was trained in the allopathic, approach, Western medicine. I'm trained in internal medicine, general cardiology, and cardiac electrophysiology for more than 2 decades. I've done, very detailed, complex procedures on the heart with electrical ablations and device implants and coronary angiograms and vascular angiograms and the like, managing patients at the largest medical center in the world. And I came across the concept of, plant-based nutrition and natural living, if you will, and found that it was far more powerful than the tools we have. And so our goal here is to use the approach, integrate, the natural approaches using nutrition, but targeted supplements and other things like infrared sauna, et cetera, and integrate that with Western medicine to help people rely less on pills and procedures and escape, that Western medicine. So let me give a few comments on that, and then we're going to share a few episodes of Heart and Soul of a Champion, and then I'll be glad to take questions. So first of all, I think integrative health is the future of medicine. Why? Because I think we're in a healthcare crisis today. This slide here shows life expectancy in the United States over time. And you can see from 1995 up until around 2014, there was a fairly steady increase in life expectancy. However, in 2014, there was a slight drop. And then we get to 2019 right here, there was a sudden drop in life expectancy from 2019 to 2020. Now, of course, that was before the COVID pandemic, so you can't just blame it on COVID. From 2020 to 2021, another drop. So from 2019 to 2020, we've had a very significant drop in life expectancy. And it started before 2019. Sickness has been the norm for a long time. If you look at cardiovascular diseases, in 2019, about 874,000 people died from cardiovascular disease. To put that in perspective of a recent pandemic, cardiovascular disease in 2020 caused about 19 million deaths worldwide, compared to only 6.73 million deaths from COVID. So it was about almost 3 times the amount of deaths from cardiovascular disease than there was from COVID, despite how horrific it was, and we shut down the world for that. But heart disease killed about 3 times as many people every year, not just 1 year. And so from 2015, 2018, black males and females accounted for, cardiovascular disease accounted for 6% of the incidence in black males and females. The different causes of cardiovascular disease include coronary heart disease, stroke, high blood pressure, heart failure, diabetes, disease of the artery. Now, if you look at the cost, now cost is more than just monetary cost. There's a cost of life and limb, and the cost of quality of life. And as a reference, I want to draw your attention to this graph here. If we look at the total U.S. military war deaths, all the wars we fought in the history, 1775 to 2022, you see 620,000 of Civil War and World War II and so forth. Now, if you add all those deaths together, you'll probably come up with somewhere around 1.3 billion deaths. That's roughly all the deaths of all the military soldiers we've lost in all the wars in the history of the United States. If, on the other hand, you then take the deaths we have every year from cardiovascular disease and just cancer alone, just those 2 diseases, you come up with about 1.4 million deaths compared to 1.3. So cardiovascular disease and cancer deaths every year, those 2 diseases combined, kill more United citizens every year than we've lost in every war, in military deaths in every war since the beginning of this country. So the life expectancy, as I pointed out, in the U.S. dropped by 2.7 years from 2019 to 2021, and 6 in 10 U.S. citizens suffer from at least one chronic illness. So sickness is the norm. There's a huge cost. Economically, the burden is roughly $3.8 trillion, which is 1/5 of our gross domestic product. So needless to say, we have to have a paradigm shift. As I alluded to earlier, here in Houston, we live in the shadows of the world's largest medical center. There's nothing like it on the planet. These heart transplant centers are walking distance. And not only do we have the world's largest medical center, but we have many different medical centers around Houston that are larger than most medical centers in most states in the United States or across most places in the world. And so we are inundated with Western medicine here, not to mention in Galveston, you have a huge medical center there that has a heart transplant center. You have 3 here in Houston. You have a heart transplant center in Dallas, 250 miles, northwest of us. West of us in San Antonio, another heart transplant center, a huge medical center. Austin has a heart transplant center. So, in a very short circumference, in about 500, you've got, let's say, 3, 4, 5, 6, 7 heart transplant centers. I may be leaving one out, but long story short, we're inundated with Western medicine. But despite all of that, sickness continues to get worse and continues to cost more. So the paradigm shift that I'm proposing is that we use lifestyle intervention, and it should be the first-line treatment of choice for the prevention, control, and reversal of chronic illnesses. And I'm going to argue both communicable and non-communicable chronic illnesses. So we have to use it as a broad approach. So I'm going to have a few slides to show some of the details of what we do, and then we'll take a break and then go into some of the docu-series episodes. So what is integrative health? We use this approach. We start off with optimal nutrition. In my opinion, that's the foundation. If you're nourishing the body properly, that's your start to having the body function properly, whether you're talking about functioning properly physically, mentally, intellectually. The body has to be well hydrated, well nourished. And then other natural interventions are added as indicated or needed. Looking at this pyramid here, the base is defined food prescription. It's not enough to say eat healthy or eat plant-based. It depends on how you prepare the food, where you get it from. We use targeted nutrient supplementation. We also prescribe fitness for our patients. And functional correction with, for instance, acupuncture or chiropractors and the like, and then you kind of fine-tune all the interventions. So the goal is to use it synergistically. Here's the nutritional component. Food is the baseline, but it's not enough to just say, okay, eat the right food. People have to be educated. We have detox programs, online programs, and we support programs like the one today, and educational programs where we bring people from the community to our communities as well. Recipe design, small group shopping, nutrient testing. So we have special blood tests we do to check for microbiome or micronutrient deficiencies. We use intravenous infusions for IV high-dose vitamin C or Myers cocktail. Physiological and functional correction, as I alluded to earlier, we refer people to acupuncturists, chiropractors, and the like. And all of this is put together. There's a synergistic approach that has to be made, whether it's, nutrition, food, exercise, and we put all of this under, and Heart and Soul of a Champion is the art form, but there's also an integrative therapeutic form of Heart and Soul of a Champion that we use to apply that in our clinic. And just as an FYI, this coming Monday on our YouTube channel, I'll be talking about giving an inside look at Heart and Soul of a Champion Season 1. So I invite you to join me there as well. You'll probably get a lot of insight today, but if you want more information, feel free to join us. So next I'm going to show you episode 1 of Heart and Soul of the Champion. All right, so episode 1, I'm going to share with you. We start off with, and let me know if the sound comes through okay. But this gives you the background, a little bit of my background, and it introduces some of the athletes that are going to be going through the program. So sit back and enjoy. Over the 25 years of practicing cardiology and internal medicine, I've treated patients with many, many advanced diseases. Following these patients, despite the advancement of technology that we've had, the patients continue to get sicker and sicker. In my busy practice, my health started to decline. I started noticing that my cholesterol went up, my blood pressure was up, and I did not want to take the same therapies I was prescribing other patients. I'm Dr. Baxter Montgomery, and I've been practicing in the world's largest medical center for more than a quarter of a century. Our center is quite unique. The Montgomery Heart and Wellness Center is located here in Houston, Texas. We have state-of-the-art diagnostic and therapeutic tools. I have a background in biochemistry. I have medical specialties in internal medicine, cardiovascular disease, and cardiac electrophysiology. So I started doing my own research. I got into nutrition. I ran across a local individual and doing nutritional detox. And I went through a natural detox and cleansing my system over a period of 33 days. In that period of time, I felt amazing. I felt like I was 18 years old at the age of 35. This caused a light bulb to go off. If this could cause me to improve, this could have an impact on my patients.
The body has the ability to heal itself when properly nourished, rested, and hydrated. We know this is effective in getting people back on their feet. However, I have a hypothesis that this intervention is even more powerful than that. This intervention, I think, can get people back to peak levels of performance. So we brought together a group of athletes who had performed at peak levels at some time in their lives. And we're going to work with these athletes, despite the fact that they're coming in with chronic ailments such as high blood pressure, heart failure, arthritis, and many other chronic illnesses. It is our impression that this intervention not only will help their body reverse these chronic illnesses, but it will also help their body get back to a level of peak performance. If you can go back and turn the clock, go back to a time where you were at your peak performance, would you do that? This is Heart and Soul of a Champion, Athletes Edition, Season 1. I've been working with Wendell Mosley for several months, and I thought, based on the previous findings, he would be a perfect candidate for this program. He had gone through our detox program successfully. However, there were a few setbacks that he had that affected him emotionally.
So I didn't really start playing football until like the 6th grade. By the time I was in the 11th, 12th grade, now I was getting a lot better and, into a starting position on the high school football team. A cousin of mine that gave me a call one day and said, man, are any schools still recruiting you? He said, well, I got a place that wants to look at you. I said, wow, let's do it. So he said, yeah. So I got a coach up at University of North Texas. And so I walked on after my first semester there. I earned a full scholarship. Senior year is when I actually started and led the team.
His initial reason for seeing us was that he had had a previous diagnosis of prostate cancer. So he underwent the prostatectomy. He had a successful procedure. And so he was seeing us after the fact. However, despite him having gone through the surgery successfully and doing well, some of the numbers were not looking ideal. And his urologists were telling him that, hey, maybe we're going to have to put you on hormones or some other type of medical therapy. And when he asked him again about lifestyle changes, he was given no answer. And he was feeling demoralized. Oftentimes patients are just focused on, well, my numbers are going up. And he was just focused, well, the numbers are going up, so I'm going to get the other test. What does the next test show? What does the next test show? I wanted to get him out of this mindset. I wanted to get him out of this frame of work. I wanted to get him back on the football field, on the gridiron, to take him back to a time where he had other goals. I wanted to put him in a space of going after goals beyond improving laboratory tests. This was going to put him in a different mental space, and this was going to help him heal his mindset about his disease state. So I've known Kenny Banks for a while and met him through his work with hyperbaric oxygen therapy and had worked out with him once or twice, and I knew that he was physically fit.
My name is Kenny Banks, 55 years old. I'm a former world-class high jumper and competed on the professional track circuit in the 80s to the mid-90s. Been in sports pretty much all of my life. Tried out for a couple Olympics. Love to still work out and stay active. And that's just a big part of my daily routine. And sports and athletics keeps me healthy.
When I started this project, my idea was to have him come in and push the rest of the group because I knew he was physically fit. However, here we are on day one. His blood pressure looks great, but after doing a stress test, my PA notifies me that he has a significantly abnormal stress test. And when I reviewed the stress test, it had very significant EKG changes, consistent with coronary disease. My concern is that someone like him, being seen by a typical cardiologist, will be scheduled for a coronary angiogram and a possible stent placement. The question is Kenny Banks at risk for heart attack or even sudden cardiac death? Our initial evaluation of Darrell Green when he came in, he seemed to be in pretty good shape. He didn't have any significant symptoms. He didn't have any symptoms of chest discomfort or shortness of breath. He had pretty good energy level. So I felt that he would be someone that we'd be able to start off with and start getting, to that higher level.
I am a former professional football player, 20 years in the NFL, with the team formerly known as the Washington Redskins, presently known as the Commanders.
Our problems with Darrell Green is that he presents to us with, number one, reporting that he has not seen a doctor in 15 to 20 years. And the problem with that is that he essentially has no baseline data for us to evaluate. The other problem that he presents us with is that he's lived a standard American lifestyle from a dietary standpoint. Now, he does exercise from time to time, but he hasn't exercised in about 2 years based on his report, at least not on a regular basis.
I'd like to live long. I like to live long because I like to have an extended impact on the world. Super Bowls, Hall of Fame, all that stuff is great because that's a tool in my hand. That's what drives me. So if I can be healthy and be there and participate and use even some of the foolish things of this world, run fast at 62 and people go, and then now I got a conversation with you.
Upon the initial set of vital signs, my staff came to me and told me that his initial blood pressure was 191/114. So that raised my eyebrows. When a patient comes with a blood pressure like Darrell Green has, 191/114, this is a blood pressure that's at a level that's considered stroke level. 9 times out of 10, or maybe 9.5 times out of 10, a doctor will send you straight to the emergency room, especially if it's a clinical setting where you cannot get CT scans or other types of imaging. This is a medical emergency. This is the type of blood pressure that doctors typically treat urgently in the hospital, in an emergency room, right away. The other thing we found is that Darrell Green has blood vessel disease. Now, we refer to this as endothelial dysfunction. Essentially what that means that he has blood vessel disease, which could mean he's predisposed to a heart attack or stroke or some other type of vascular problem. When I started this project, I had the goal, the vision, to take retired athletes and take them to a level of physical performance that was either near or at their previous peak levels of performance. The tricky part about Darrell Green is that my scientific mind is struggling with my human football fan mind. My scientific mind, my medical mind, is saying this individual is at risk for heart attack, stroke, sudden cardiac death. My sports fan mind is saying this person's physically fit. This person can run a 4.340. This person is superhuman. And I'm struggling with this individual. And I know that nearly half of the individuals with cardiovascular disease present with sudden cardiac death as their first symptom. And now we have to make a decision. Should that be send them to the emergency room or not? I met Raymond Waddy through Darrell Green. The night before the first visit, Darrell calls me and says, hey, I have this friend, Raymond Waddy, and I just found out after talking to a mutual friend of his that he was recently diagnosed with congestive heart failure. So last night we talked, and I talked to Raymond. His wife is on the phone through speakerphone, and I just shared with him that I think what we do can help. And so he decided to come in. He still wasn't sure what he wanted to do even after coming. However, he completed our intake form, and as of now, he tells me he's all in.
Most of the people that know me call me Ray. If you really know me, they call me Stack, because that means I grew up with you. And probably more known as Coach Watt. I was fortunate enough to earn a scholarship to go to college to play football. I was an undrafted free agent, signed with the Washington Redskins, and ended up being fortunate enough to make the team and spent a little over 3 years with them. So I ended up going to the St. Louis Cardinals, getting released, the last cut. I left there and came back to Texas to student talk. Left Kingsville and went to Canada and played in the CFL with Edmonton and British Columbia. Left Canada, came back to the States in the newly formed United States Football League and finished my career in '84 in San Antonio.
So Mr. Ray Mawadi comes in, and I look at him. He has a very, very distinctive limp. He's obese. He is wearing an external defibrillator. So he's not the perfect picture of health. My concern with managing a patient with heart failure is that we have two major problems with heart failure. One major problem is that heart failure patients can become very ill and die from overall poor circulation. We call that pump failure. Overall poor circulation leads to kidney failure, liver failure, GI failure, and brain dysfunction. And individuals in this condition are very, very sick and very, very hard to manage. The other situation with heart failure is that heart failure patients are at risk for sudden cardiac arrest. 1 minute they're up talking to you, the other minute they collapse in death. So sudden cardiac death or slow pump failure. These are two very difficult things that we deal with patients with heart failure. Raymond Wadi's heart failure is so bad that he has to walk around with a device about the size of a transistor radio to monitor his heart in the event that he suffers a cardiac arrest.
In 2019, I was diagnosed with cancer after having a complete hysterectomy. Talking about a good husband, he was there with me from start to finish. We cried together, we prayed together, but we got through it. It was very hard. Some of the things that I went through, some men couldn't stand it. He stood, and he stood with me. I tell you, that's God. That's a godly man and a loving husband. And we've had other challenges. I lost my bonus son. He was my godson, but I call him my bonus son. In January of 2021, he was hit by a car. That was devastating to me, and he was only 29 years old. April of 2021, I lost my dad. In January of 2022, I lost my only grandson that was 17. I'm still having a hard time from both of those, and he's been right there by my side. So, it's been a lot for me.
I lost my brother
in March
to brain cancer. Leading up to before I was diagnosed, I had been feeling very tired, very fatigued, and I started having shortness of breath. And so my wife said, well, you need to get an appointment. So I got an appointment with my PCP. He did a EKG, and they found an arrhythmia, abnormal heart rhythm. So he sent me to the cardiologist. The cardiologist called me in and told me that I had congestive heart failure. That was a lot to unpack.
When we got that news, we were both just like dumbfounded.
It was just a lot of unknown uncertainties. What did that mean, congestive heart failure? Is I'm going to have a heart attack? Is my heart going to stop working? Which basically is a combination of all those things that could happen.
The most important thing that I noticed about Wadi, he has this continence, facial continence of hopelessness. That is the most worrisome symptom that he has, in my opinion. That symptom is the most difficult symptom to deal with any patient. When a patient has lost hope, then that patient is a patient who's very difficult to treat. My main intervention with Raymond Wadi on day one has been to introduce a sense of hope and direction. What we're doing with him today, come up with a game plan toward healing your heart. And this is the strategy. And this is our plan for victory. I'm taking him back on the football field. And I'm giving him a plan for victory. And this time the victory is to heal his heart. Well, during his treatment on the ECD bed, I walked up to him and I said, well, what was your best time in the 40-yard dash? And he told me it's 4.49 seconds. And I said, oh, great. That's your goal. Your goal is 4.49 seconds. Now, he looked at me and laughed with a look, hey, this sounds ridiculous. I said, no. I had a very serious face. I'm very serious. Your goal is 4.49. And I talked to my staff and I explained what we were doing. I said, look, Mr. Raymond Wadi's best time in the 40-yard dash was 4.49. Our goal for him is 4.49. Every time you see him, I want you to say 4.49. It's a realistic goal. It's a goal that we want him to make his own goal, even if it's a lifelong goal. 4.49. One thing we've dealt with in our approach to treating patients with chronic illnesses is a paradigm shift in our thinking in terms of how people should age compared to how we currently age. If we look at individuals who are aging, who are developing chronic illnesses, our natural thought process, or at least our current thought process, is there's a debilitation over time. Similarly with athletes, but the everyday individual. But what we've come across is a different way of thinking about this, based on our historical clinical evidence and clinical experience. The paradigm shift that we have come to is that individuals should improve their performance over time, not decline. Because seeing how individuals with severe illnesses who are on death's door can turn around and be revitalized, can we get retired athletes to function at their peak level of performance when they were very young, regardless of their baseline medical condition? That's what we aim to see. These athletes are going to be surprised at the accomplishments that they will make during this program.
Maybe this is something that can help me come here. I just think it's something that prayerfully there will be a benefit to me and other people as well.
I'm excited. I'm ready to try to do this. It'll be interesting though to see what the change is from where I have started my baseline, right? So that'll be an interesting part to see.
Essentially, the illnesses that Mr. Banks, Green, Mosley, and Wadi are dealing with kill more people every year in the United States than all the deaths that we've lost from American soldiers in United States history.
That's the heart of the champion. The heart and soul of the champion.
All right. right. Any questions about anything in the presentation so far? We got it's a large group here, 62 people on a Saturday morning.
Are you accepting new patients, Dr. Montgomery?
Yes, we accept new patients. Let me put my website in the chat and also our office number. And if you go to the website, it has a phone number, and you can email for an appointment or any information that you'd like to get from us.
To discuss hydration and the importance of having hydration where it concerns with cardiac issues.
You know, it's interesting. It's a great question, and hydration is very important. Yeah, and hydration, even though it should be something that's very simple, in some aspects can be complex because, you know, a lot of people ask what kind of water to drink, and, you know, there are a lot of different theories. That some people argue in favor of alkaline water, which I think is a good argument for. Some people argue in favor of distilled water, but then some people say it's poor in minerals, then you have to reinfuse with veggies. And I think, you know, there are different approaches you can take with water. I like to say you should consume foods that are naturally hydrating. So if you eat your water, for instance, you know, cucumbers or melons, you know, that are very hydrating foods, then if you're eating a lot of raw plant foods on a regular basis, you're going to hydrate yourself naturally that way. But hydration is important, and one of the points that I make in the docuseries, and this Monday I'll be talking about the docuseries, giving some insight to some of the background, is that if you take someone who's poorly hydrated or dehydrated, if you will, then your body's cardiovascular system is not able to circulate blood effectively. And in essence, the inability of the heart to circulate blood effectively throughout the body is the fundamental definition of heart failure. So when you are dehydrated, you're giving yourself the same physiology as somebody with heart failure. And so that's how powerful hydration is and how detrimental dehydration can be.
I love how you mentioned eating the hydrating foods, because I know a lot of people, including myself, struggle with getting enough water in, you know, because we have to do half of our body weight in water, correct? Mm-hmm. So knowing that we could do the watermelon and the celery and that type of thing, but how do we know how much of it that we can eat in order to hydrate the body properly?
Good question. You know, there's some simple rules of thumb. I tell people if your urine is clear, watery, that's a good sign. Now, of course, if you're taking vitamin supplements or if you're consuming, you know, cold-pressed beet juice or something like that, then your urine won't be completely clear. Beet juice can make your urine look bloody. However, even in that setting, if you're consuming a lot and your body's overhydrated, you're going to be putting out a lot of water. And even, you know, if you're drinking beet juice or taking supplements that's in the color of your urine, that will be very dilute and very light colored. So you want a urine that, in the setting where you're not consuming, say, beet juice or whatever, to be as clear as water or extremely dilute. And if you're going to the bathroom a lot, you know, ideally during the day, then that's a good sign. So you want to drink the hydration. So let's say you get up in the morning and it's, you know, watermelon season, and of course, once you eat watermelon with seeds, but you eat half a watermelon, a whole large watermelon. I mean, you're going to be going to the bathroom a lot, or a couple of cantaloupes. Then you know that you fully hydrated your body, because the body, takes up the water it needs, it flushes out. The other thing is that your bowels will move more easily, and your bowels will be less formed. They'll be softer. You have bowels that are very formed and hard to push out. That's a sign that you're not well hydrated, because volume depletion, dehydration leads to constipation. Or if you're not constipated, but the bowel is, when it hits the toilet, and I'm not trying to be gross, it doesn't break up easy, then your colon is extracting a lot of water because it needs a lot of water. So if you're very hydrated, your bowel's going to be loose, you're going to be urinating a lot, and you'll feel more energetic.
So is that something that we can use as a guide as opposed to half of your body weight in water? So basically, if your urine is clear and your bowels are loose?
I think so, largely because, half your body weight, I mean, I'm not saying that's a bad parameter. I mean, it's nothing wrong having a general, starting point, a general estimate. But the best we can do is estimate because, it depends on your circumstances. We were doing the doctor series. We were running heels and things and working out in very hot conditions, and the body's sweating a lot. If you're getting in the sauna on a regular basis, you're going to be sweating. So you may need to drink more than half your body weight on some occasions. So it just depends on what your volume demands and your body's demands are. And that same thing goes with eating. I mean, so your demands are going to change depending on the circumstances you're in.
That is really refreshing to know because I struggle with the water personally. I'm always trying to drink the water, but I'm not getting to that half of the body weight. But I do enjoy eating watermelon and celery and salads and things like that. So that is very comforting. It's really good to know.
Yeah, a lot of variety, cold pressed juices and things like that are helpful as well. Sorry to cut you off.
Yes, I do the cold pressed juices as well. And I do my own juicing, and sometimes I get some from our juice man, Darren. There was a drink that you guys mentioned, the green water, that was mentioned in the video. Well, I saw the whole series.
Yeah, the super
I couldn't. It was.
I have a bottle here. I finished drinking it. I should. We make it. There's green algae in it. And today I went and walked a few miles, and I had my cold pressed juices and my superfood water and things like that.
So the superfood water, is that the same as the green drink that they were drinking in the video? This is like later on series.
Yes.
Okay. So what is that made of?
Let's see. We got mint, ginger, parsley, E3 live, the blue-green algae, all mixed in water.
Okay. Is that something that we can make?
It's something you can make.
The ingredients, or is that something?
Start in the kitchen and buy it. But yeah, it's easy to make. And these things, one thing we plan to do is start distilling our water and then reinfusing with plants. That may be the best approach. Again, there are different arguments on water. You can probably break out some more on water. But I think, you can. This adding plants to water to infuse it helps, and then of course eating your water is beneficial. A lot of people are big proponents of coconut water, things like that.
I have a question for you, Dr. Baxter.
Yes, sir.
What role do magnesium and iron play when it comes to the heart and the cardiovascular system?
Well, they're important for the cardiovascular system. I mean, of course, iron, in terms of oxygen delivery is important from that standpoint. So, but that's a universal benefit. Similarly with magnesium. Magnesium is an ion. It's mostly an intracellular ion, and it's ideal for muscle function, cardiac muscle and skeletal muscle, but also rhythm management. So the heart has its own electrical conduction system, and magnesium is very important as an intracellular ion in the conduction cells. So many people are magnesium deficient for a lot of reasons. I mean, our soil's not rich in minerals. It's good to have consume foods that are, sea vegetables that are rich in minerals. We have to supplement magnesium in an inorganic form in a lot of cases where people are severely magnesium deficient. Oftentimes people are consuming diuretics, either prescription diuretics or they're consuming beverages, i.e. coffee or things that has a diuretic effect, and then they be wasting magnesium as well. And then also people take these proton pump inhibitors, such as Nexium or the like, and Photonics, and those things inhibit magnesium absorption in the GI tract, an abnormal microbiome. So there's mineral deficiency is big, and magnesium is at the top of the list of what we're aware of.
Thank you. Thank you.
There's also a question. Someone asked about detoxing. What detox would you recommend?
Yeah, that's a great question, and I'm familiar with the CKLS, and I think CKLS is an excellent product. I've used it before, so I do think that that's a good product. But from the standpoint of detox, in the absolute sense, from a conceptual standpoint, the detox starts with not toxing, and so the body naturally cleanses itself. The body has, liver, the GI tract, the kidneys, and the body naturally detoxes itself. So we become overburdened with toxins or overly toxic because we consume too many toxins, the processed foods we consume, the dead animal flesh, and these things. And so the first step in detox is to not tox, to remove the toxic things we consume. If you think of physical food, it's toxic food. You think of other types of toxic things, toxic stuff we're looking at on TV or whatever. So you want to remove toxins from the system. And so detox starts with what you remove from your diet. Optimal nutrition starts with what you remove from the diet. So my favorite detox is to not tox. And you can start with that, regardless of what supplement you may or may not use. And you want to remove toxins, hydrate, and eat only natural plant-based foods in a natural state. That's the detox that I like the most.
Okay. And I just wanted to share, because as I mentioned, I went through your program and did the 30 days. Mm-hmm. And I wanted to share what my results were, so those that would be interested in doing it as well. And if you could kind of go over some of the results. I'm kind of embarrassed to share this. And at the time when I did this, I felt like I was healthy, at least, partially healthy. And when I got the results back, it showed that I really wasn't all that healthy because, all right, so the first one was, is that the date down there?
Yeah, February.
So that was February?
Uh-huh.
Okay, and then the next one is in April. Mm-hmm. And so I was really surprised because the year before, I was eating healthy. Mm-hmm. And, kind of not really working out, but kind of, I wasn't sedentary. And if you could kind of explain some of the things on here.
Well, the pulse test, basically, it's a test that looks at a number of different inflammatory markers, and you can see them down there. And just to sum it up, it's a way of measuring, it uses like about 9 different parameters, about 6 of them are inflammatory markers. So from a biochemical standpoint, it's looking at the amount of inflammatory activity inside the blood vessels. And it's taking that, those components and matching it to some other things such as age and gender, in particular like the hemoglobin A1C. And so it's come up with a scoring system. So essentially it takes some biochemical things and some demographic components and saying, okay, based on these test findings or these biochemical findings, you have an X risk of having a cardiovascular event. So the percent number that you're looking at is the percent chance of having a cardiac event, whether it's a heart attack or stroke, in the next 5 years. We like to keep that percentage less than 3.5 in general. That's the normal range. You definitely don't want to be above 7.5%. And so we do calculations. We could see calculations as high as, say, 80% or something like that, which is, ridiculously high. But we see them that high. In yours, in February, you came in, you had a pulse score of 4.7%. So that means you had about a 4.7% chance of having a cardiac event. It's really in the borderline range, and it's not very bad, and especially considering what we see on a regular basis. So I don't think, your characterization of your health, being surprisingly bad is not, a bad thing, because I think, this does show that, you were doing a good job of taking care of yourself. But the borderline, as opposed to certainly not in the red. And then you went to the detox, and then it came down more, by more than 25%. So that was a very significant drop in a relatively short period of time, which shows that, these things are reversible. and so the amount of inflammation in your vascular system improved greatly.
What really shocked me, I think, was this one. the heart age.
Yeah.
That's what got me. I'm like, oh my God.
Yeah, it's this thing is pretty rough on the heart age. It's it probably is more aggressive than it needs to be, but you certainly had a pretty significant decrease, about 10 years in 2 months. So it's amazing how much improvement you would get with just doing the detox, and it just shows that these things can be reversible.
Yes, and the other thing was the cholesterol.
Yeah, it's good side-by-side comparison. So the total cholesterol was about 213, and it went down to 176. The LDL cholesterol started at 132, went down to 104. And so those are very, very impressive changes in a short period of time, without medications.
30 days like, what did you have to do in those 30 days? Was it diet, exercise?
Yeah, it's 100% raw plant-based diet. Now, we never, exercise and all of those things are also beneficial, and we encourage those things. But what this shows is, and we published this in the medical literature, just by getting on a raw plant-based diet, you can get these powerful changes in a very short period of time. So, yes, exercise is important. We strongly encourage it. But what we've shown in the medical literature is that the raw plant-based diet is very, very powerful. And we see, these improvements frequently.
People typically say our weight loss is 80 or 90% of what we eat. What's your response to that?
Yeah, weight loss, clearly what you eat or don't eat is important for weight loss, largely because the thing is that when we consume toxins, I mean, we think of weight gain in terms of calories in, calories out, which, again, that's a significant part of it. However, when you're consuming toxins, you have to realize that the toxins have an adverse effect on the liver. They cause inflammation. And so they put weight on you by causing increased swelling. And so, a lot of people have a lot of fluid retention, largely because they're swollen and they're inflamed. And so that's a huge problem, with people that, are putting on weight because, okay, they're consuming it largely because they're just consuming toxins that are having a toxic effect. And when you remove these toxins, the swelling goes down. And when the swelling goes down, the weight goes down. We had one lady, the greatest amount of weight loss I've seen in 1 week was 47 pounds. Well, I mean, she lost a lot of fluid weight, and she was swollen. She was a very, large, heavy woman, but she was very swollen in addition to having lots of fat. And then when she went on the detox diet in 1 week, she had a lot of swelling that went down and her weight went down. And so, that's a component there. So here's an article we published in the Clinical Cardiology Journal. It's titled "The Fine Plant-Based Diet Utilized in Outpatient Cardiovascular Clinic Effectively Treats Hypercholesterolemia, Hypertension, and Reduces Medication." So we essentially showed a 40% medication reduction, and we showed a significant reduction in blood pressure, serum lipids, and all these things. So I'm just going to kind of go through and show the statistics. They're mostly female. You don't see studies with mostly female, and the majority were black, which you don't see a lot of studies for that. But they had a mean of 3. The BMI was mean about 37.5, so there was a crowd that had a median in the obese range. There were 9 people with BMI over 40. They had a variety of diseases. Although we recruited people with high cholesterol, high BMI, and hypertension, they had other diseases such as diabetes and the like. And they were on a variety of medications, about 45 blood pressure medicines, ACE inhibitors, ARBs, and so So these were the variety of things that they had taken. Now, if I scroll down, here's our food classification system, and we call it a defined way, number 0 through 10. The higher the number, the less healthy the food is, or I should say the lower the number, the healthier the food is. And we don't recommend above 6. The detox goes as high as level 4. So in detox, any cooked foods, that's level 5 and 6. So we go through, and these were some of the findings we had. I'm going to talk about the calories in a minute, but the amount of fat went down very significantly. Saturated fat went down significantly. And these things are omega-3, 6. And so the omega-3 went up, but not significantly, but the omega-6 went down. So the omega-6 to 3 ratio improved. But you see a lot of improvements in things like cholesterol in the foods. This is the content of the food, and so you see a lot of reduction in these things. I'm going to spend time on that. But the baseline changes, I did want to say this about the amount of calories they started. This is based on a nutritional recall, but they started out with the baseline caloric intake of about 2,000 calories, and it dropped to 1,369. Now, I want to emphasize this because we told everyone to eat at limit, eat as much as you want, eat a lot if you need more, and we provided all the food. So if they needed more, they can get more food. So all the food they need, despite trying to encourage them to eat a lot, eat too much if you can. They still went down by caloric intake. And my theory is that when you're eating a nutritionally superior diet, your appetite is going to naturally be suppressed. And we see that, we've seen that for over 2 decades. So the findings were weight loss, baseline, 108 basically a mean kilograms, went all the way down to 101.4. The BMI went from 37.5 on average all the way down to 35. But you had significant differences even within 1 week. Okay, you lost 3 pounds in just 1 week. That was statistically significant. This 1 week, and then the next week, another 2 pounds. That was statistically significant. And the following week, there was a difference between the year. So you had a statistically significant loss of weight every week as you went through the regimen. So, that was very powerful. Waist circumference, so that went down significantly over the 4 weeks. And again, it had a significant drop from week to week. Systolic blood pressure went down. And again, this is when we were decreasing medications. So, had we left them on medication on average, you might have seen people with hypertension. The diastolic pressure went down. So the number of medications on average, blood pressure medicine went from 1.6 to 1 medication. So a significant reduction in medications over time. That was heart rate went down. Other prescription drugs went from 1 to half, and that was a significant difference there. So not only did the blood pressure medication went down, but the total medication count went down. And so you have, let's see here, the medication reduction was about 38%. And the other drugs went down about 50%. So the total medication reduction is about 40%. If you look at other parameters, total cholesterol went down very significantly from baseline to final. 33% change, LDL cholesterol 24% change, and triglyceride 19.6. If you look at the hemoglobin A1C, now this is important. Hemoglobin A1C, a lot of people are finding out diabetes. The doctors measure hemoglobin A1C. Now remember, we did not recruit a group of diabetics. These were people with high blood pressure, high cholesterol, and high BMI. Now, some were diabetics and some were not, but we didn't say, okay, recruiting diabetics. Had we recruited diabetics, then the average A1C would have been higher because to be a diabetic, you have to have one. Now, of course, some have lower A1Cs, but the chances are it would have been higher. But this wasn't a group of diabetics, but their A1C was 5.9. That that's in the pre-diabetic range, from 5.7 to say 6.4 is pre-diabetes, 6.5 is greater is diabetes. And so this is in the pre-diabetic range. But look what happened. Even though the A1C was almost normal, it went down by 0.2. Now, that may not seem very like much, but that's a 34% reduction in hemoglobin A1C in just 4 weeks.
Dr. Montgomery, what is the A1C and how important is it?
Great question. So the hemoglobin A1C is the measure of amount of blood sugar that's attached to red blood cells. And so the A1C is used to give, it's an estimate of your average blood sugar over 3 months, okay? So if your blood sugar has been high, it looks back over 3 months, the A1C gives you an estimate. So then the natural next question would be, well, how can you change an A1C in 1 month when it represents a 3-month average? And the answer to that is that the other thing that affects A1C is that there are fluctuations in blood sugar. So like if you're having large swings, highs, and lows, then that'll increase the A1C as well. So you want to decrease the amount of swings. You want to decrease the difference between the highs and the lows of blood sugars. And what I theorize here is that what we did with the diet is that we decreased those wide swings. And the decrease in wide swings is likely due to the fact that there's a decrease in postprandial blood sugar. And that brought down the A1C. C-reactive protein is a molecule that measures inflammation. And we saw a 30% reduction in inflammation on average in this group in just 4 weeks. And that's really important, because inflammation underscores a lot of different chronic illnesses. Lipoprotein little a, I'm not going to go through all the details of the study. It's the same population of people, but we saw a significant drop in lipoprotein little a here by about 16%. We were the first to show in the medical literature a reduction in lipoprotein little a. ApoB and those things change as well, but I wanted to show you that in this one. And then lastly, another publication we have is a case series of patients with congestive heart failure. And we have...
The other one, I'm sorry.
Can you share the name of the other one? Someone is asking what that article was, the one you just shared.
Oh, yeah, I'm sorry. Hold on.
And do we have access to the article? And then I have another question on this article before you leave it.
I tell you what, if somebody drop a central email in, in the chat, I'll copy and email it to you. Email both of these.
Beverly, you want to put yours or mine?
And you know
I'll put mine in right now.
Okay, yeah, I'll have yours anyways, but I can share these on email. This is the name of the article here. If you're on a screenshot that, and I'll share these with you as well.
I got it.
The other article, we published a case series, and essentially what we did is that there were 3 patients who had heart failure, and we have more patients we've seen these findings on. The reason we only published these 3 because we had cardiac MRIs before and after. And logistically, getting cardiac MRIs is a little bit challenging, so we don't get them before and after on every patient. But anyway, this case series of patients with heart failure, and the average ejection fraction stands for the percentage of blood that the heart squeezes out with each beat. So you want that to be at least about 50%, preferably 55 to 60%, but then you want at least 50% to be, normal. So in other words, with each contraction of the heart, you want the heart to squeeze out half the amount of blood, the left ventricle that is, squeeze out half the amount of blood that's inside of the ventricle. So that determines your circulation. If the heart's squeezing out less than that, let's say, 30% or 20%, then you're in congestive heart failure. So these patients with congestive heart failure, the average ejection fraction right here was 22%, plus or minus 7%. And after the plant-based diet intervention, the ejection fraction on average went up to 42.4%. So that was clearly an improvement in the ejection fraction. I'm going to scroll down and share these numbers here. So the ejection fraction baseline around 22%, an increase after the intervention, the nutritional intervention. The hearts were thickened, enlarged, and so the LV mass is a measure of the enlargement of the heart. The enlargement of the heart went down. And then stroke volume, which is the volume of blood that the body squeezes out each time, that went up. So the more the stroke volume, the more volume the heart is able to, the more volume of blood your heart's able to excrete with each contraction, the more efficient your circulation is. And cardiac output is the measure of circulation that improves. So essentially the heart's got smaller and stronger and more efficient in circulating with this diet. One of the patients, this is a patient of mine that took to the cath lab, she was having chest pain. When I did the coronary angiogram, she had a very tight narrowing, stenosis right here. This is a LAD, and this is called a widowmaker. In this case, it would have been a widowmaker. You shut this off, you shut down the flow to about 75% of the heart. And then we offered her a single vessel bypass. She said, well, she had already started the detox. She's got on detox, stayed on it. And I recapped her after about 5.5 months, and this is the artery there. And it's opened up, and so she's done, well. So I'm just sharing with you how, this is, I'll come off the share screen. Let's see here. How this approach has been validated scientifically, and it's one where, we can all make good use of.
That first article you shared with us, you had a food list, and it had ratings. Can you go back to that? Because what we try to do is encourage plant-based as well, and we want to make sure that we understand, like the ones that you said, the ones are better to eat and the 10s are worse. So can we look at that in detail?
Absolutely.
We typically tell them, is what Mrs. Sunshine has always taught us, if you have an issues going on in your body, to try and do liquids first and then eat raw. He told us that when we put heat under the food, that it kills the nutrients in the food. And so it's right in alignment with what you're sharing with us. So I know a lot of people have different issues going on with their hearts and different things. So what we try and tell them is to stop what you're doing and try and reset your system. And the resetting your system will allow you to take all that stuff out, and then as you add whatever back in, hopefully you don't add the bad stuff in, but if you do, you can probably see what's going on with you. So as you talk about these food items, if you can tell us how that would allow us to adjust our A1C and so on, that would be awesome. And someone just asked, where are you located at?
But I'm in 1040 Main Street. We're on South Main, I should say. South Main, south of 610.
And do you take insurance, Medicaid, Medicare? What tell us about that as well.
We take insurances, Medicare, Medicaid, private, so we take, anybody that will take us, we'll take them for the most part, but yeah.
Awesome, that's good news. So basically what y'all are hearing, Dr. Montgomery, is into us being healthy, as was Sunshine. So now we'll let you go through this list, and then we'll see what other, someone says, do you have a PCP that you work closely with?
So there's a number of PCPs we have a relationship with. Dr. Joanne Large we work with. That's Dr. Vandana Challa, there are a number of PCPs, Dr. Green, we have patients, and so there are a number of PCPs we work with, we share patients with. But a lot of people just come and see us straight away.
Okay, awesome. Thank you so much. So we're going to let him run through this food list and let us know how this will benefit our bodies. And thank you so much, Dr. Montgomery.
Oh, you're welcome. Thank you. And so the classification system, we use a numbering system, and it's pretty much an agreement with what Sunshine has been teaching over the years. As I say, the lower the number, the healthier. So level 0 is any liquefied plant food. So that's water, tea, unpasteurized fruit, so cold pressed juices, smoothies of the like. We do allow for some herbal teas that are steeped, but that's a level 0. And the 0 is important. Someone's very ill, they may have gut inflammation, some people have poor dentition. So they're not able to break down or chew their food very well or absorb it very well for whatever reason. So we've have a lot of patients, some of sicker patients, like in heart failure, that are too sick, give them up for hospital, put them on a smoothie feast or a cold pressed juice feast and let them turn around. So the level 0 can be very powerful for a powerful detox and help people turn around rapidly. Numbers 1 through 3 are solid raw foods. 1 is low glycemic index, 3 is high glycemic index, and 2 is in the middle. 4A are raw high-fat food. That's where you get your avocados, your raw seeds. Theoretically, raw nuts should be here, but raw nuts are tricky because a lot of nuts people get a hold of are steam shelled or whatever the case is. So raw nuts are good, but we put them at level 6 because there's a question mark oftentimes with their steam shell. But raw seeds are particularly good in avocados. So for high-fat raw foods are 4A. 4B is when you get the dehydrated things. A lot of the dehydrated breads and wraps, less than 160 degrees ideally, maybe more ideal, say less than 120. But long story short, dehydrated foods are 4B. 4C are going to be foods that are dried, warmed at a higher temperature than say 160. And then they may be steamed or boiled for very, very short, like blanched almost short period of time. But 4C is when you start to add higher degrees of heat. And then 5 and 6, again, from 0 to 6, you're still plant-based, 100%. 5 is higher temperature, warm, dry, and boiled or steamed for 4 to 10 minutes, or boiling 10 to 15 minutes, 10 to 45 minutes. When you get to level 6, same as 5, just a longer duration of boiling and steaming, and higher. We advocate people stay away from 7, 8, and 9, as well as 10. This just gives
While you're on 6, you mentioned nuts earlier. Can you eat too many nuts in a day?
Well, you can. Too much by definition is too much, and so you can eat too many nuts, and you can eat too much, drink too much water. So too much is possible. It's hard to do. A lot of people. It's easier to eat too many cashew nuts than it is to drink too much water, but you can still eat it.
And the best nuts to eat while you're there. What are the top nuts to consume?
My preference are like a good raw walnut or pistachios. Almonds can be tricky. If you have a good source of almonds, you know that they're not blanched or pasteurized, and almonds are okay as well. But walnuts, pistachios, good raw pecans, if you get local, are fine as well. We use cashews sparingly. We're trying to back off on a lot of our recipes with cashews and work with our chefs, so we make a lot of our sauces with non-cashew seeds and nuts. But cashews are okay, you can get by with them, but man, those things can be addictive.
Yes, pistachios are as well.
If you want to kill somebody, you can lock them in a small pantry that's loaded with cashews, they'll eat themselves to death. But anyway, so 7, 8, 9, and 10, I won't go over the details. You can see it there, and it's in the articles, but those are animal proteins. But see, you can have plant foods that's in this levels too. So you have deep-fried okra, sauteed things, sauteed in oil. So it's not just whether it's an animal food or plant food, it's how it's prepared. And so that's in there too. Now, there are other underlying characteristics that we use for the food classification system. And part of it then tells how the food was how it was raised, if you will, or grown. And even though I don't spell it out here, it does this influence. So, for example, if something is wild, so it's caught in the wild, then it theoretically is better than something that's cultivated organically. Some cultivated organically theoretically is better than something cultivated inorganic. Now, organic, there's a quotation mark there because a lot of people pay money to get something, to be certified organic. However, you can have a farmer who's growing things, even beyond the organic standards in a sustainable way that may have a better quality food than somebody that has the organic label. So, the labels can be tricky, and we're going to start to address that in future publications.
there's a question about what role does acid play in artery damage and or blockage?
You know, nobody looks at, I haven't looked at studies that say, okay, acid does this, that, and the other. However, acidic causing foods can be problematic. And so I would venture and say it has a big role in causing damage. Instead, I can't point to any publication that says, well, see, we've done a study with somebody, with an alkaline ash urine output compared to an acid output, and these are the cardiovascular findings. But we know that people that eat foods that we attribute to as being acid-causing foods are also foods that are damaging to the cardiovascular system. So I'm not sure if that study needs to be done, but my answer would be, they damage endothelium cells, these types of foods, etc. And it's not just because they leave an alkaline or acidic ash, if you will, but they have other components. So they've probably done multiple things. So the acidity of them is certainly one component, but the destruction of the vascular system may be another aspect of the food that's leading that front.
Okay, and what about oils? How does it affect our system?
We try to have people avoid oils, largely because oils are tricky. They're not stable. You extract an oil from a food, and you've got to store it in a glass bottle that's dark and cold. But when you open a bottle, that's one issue. People buy oils off the shelf, and this labeled first cold pressed. So we work hard to recommend that people minimize oils. I was seeing a patient the other day who he's battling cancer, and he has access to this pristine olive oil and all which he plans to use. But certainly with cardiovascular disease, we strongly recommend that people not consume extracted oils.
Is there something that you guys use, like when you're preparing a meal, what do you use in place of oil? Is there something that you can use instead?
Well, we grind up the seeds. So if you're gonna, if you want to make because salad dressings typically have like an oil, a fat, a sweet, and an acidic component, like citrus, like lemon juice, or whatever. So if somebody wants to make, we'll say, okay, get some hemp seeds and grind it up, or sesame seeds and grind it up, and then the ground up. So you have the whole food there. You have the fiber and the fat that's all there, and the fat stays locked in the food as opposed to when you extract it. And sometimes these things are chemically extracted, and sometimes they are heat extracted.
Okay. How does the supplement berberine?
Berberine, yeah.
You see the question there?
Yeah. So berberine, it's a natural PCSK9 inhibitor, which is a fancy term if you have, high PCSK9 activity, it's going to increase your LDL cholesterol. That's just an enzymatic pathway that we've discovered. And the drug, you may have heard of the drugs Repatha and Prevnuent. These drugs are injectables that decrease PCSK9 activity, but berberine also does that and enhances metabolic condition. So it affects atherosclerosis by helping to reduce LDL cholesterol through inhibition of PCSK9.
In one of the episodes, you had discussed the main cause of your mother's death that was due to prolonged use of medications.
Mm-hmm.
So what are some of the things, because I know a lot of people, most people I know are on medications. And if they get off the medications, then there are adverse reactions. What would you recommend? Because I know going straight to raw, it would be very challenging. What would you recommend for them to get off of the medications eventually?
Well, ideally you want to be under medical supervision, so your doctor can work with you. What we do in our facility is that we put people on the raw diet immediately, even though it's challenging. It's challenging maybe for the first week, maybe the first 2 weeks, but after that it becomes less challenging because you start getting very good results, pretty quickly. And then we follow them very closely. We see them frequently. We start to wean their medications within the first within the first, few days, week, etc.
Yeah, because I noticed that that's what happened with me. Like the first week or the first 2 weeks was very challenging, and I think when I tried to do the vegetarian thing a while back, like when I was younger, my issue was finding the foods to eat. It was like, okay, I'm so tired of salads. What else can I eat? And that type of thing. I think you guys have recipes that you suggest?
Yeah, recipes, but we have a restaurant, we have grocery store, the recipes online. We have on our website. If you go to the main website, montgomeryheart.com, you see those slider screens. You can see you do Jumpstart, and that a free video that people can go through. I do like a handful of videos and walk you through a 7-day detox and recipes and the food and I think there's like a 10-day food guide in terms of recipe meal plan, I should say. And so we have those things available. There's some things, other things on the site, the Rebuild program. We have an online community. There's HLS program where through a series of Zoom calls you can register for that. Those are some small investments, but the HLS programs you can go on, and just like we're here on the Zoom call, you can. I have an integrated care coordinator who coaches people through the raw diet. We've had people from all over the world on our community and our detox programs going through and detoxing. So you can get to us. Let me share some of those links in the chat here. Hold on.
Okay. I'm going to ask if you still offer the boot camp.
So the boot camp is online, and it's in the form of this. I'm going to share the component that's the boot camp. I think I may have. Okay, that's the. Now the boot camp is the equivalent of our online healthy lifestyle series. Now the ones I just dropped in there, one is called montgomeryheart.com/jumpstart. That's the Jumpstart program. That's free. You can get on that and do a 10-day detox with recipes, and that's me talking to you. The next one I put in there is the Rebuild. It's an on-demand course, and you have a year's access to 2 30-day detox courses, which are designed after our boot camp, plus lots of recipes and video, and you have access to our community, which I'm going to share with you in just a minute. The next one is, let's see, our Healthy Lifestyle Series program. So this is a healthy lifestyle. So this is coaching, group coaching, and with both the Rebuild, which is an on-demand coaching program, and the Healthy Lifestyle Series, which is group coaching, both of those get you a membership, a 1-year membership into the community, which I'm going to load in here. And that's montgomeryheartwellness.com journey. And that tells you about the online community supports optimal health journey.
Is there something that you would recommend for people that are having issues but are on a fixed income and may not be able to afford different programs and things like that? What would you recommend for them to get started on their health?
Well, the Jumpstart program I put in the chat is it's a free program, and they can go online and click on that, and there's no cost to that at all. And the thing I like about the Jumpstart, you can take that. One of our page, he lives in Australia. He's in our community. And he couldn't come because he didn't take the vaccine. They won't let him in the United States. He wanted to come and see us. But he went online and he took the Jumpstart course. And he took those recipes and modified them to a certain extent. And he just kept doing the 10-day Jumpstart over and over. And he got a lot of benefits from it. So you could take something that's free and make a lot of use out of it, and they can do you a lot of good.
Oh, that's awesome. That is wonderful that, you have something like that for everybody, basically. Your program looks like it covers for everyone in any physical and financial situation. And that's really beautiful. I feel so blessed that we have you here in Houston, near where we are.
Yep, we have our clients are far and near. We have people all over the globe who's on our community, patients who come from coast to coast to see us, with patients all over. So we try to accommodate. And we're working hard to grow and expand. The grocery stores there and things like that. The detox center, we're looking, God willing, we'll expand the medical facility and have more room to do other things as well.
Okay. I did want to know about oxalates. When I was looking at your list of the 0 through 10 in the process of what's best for what kind of foods are better for your body, one of the speakers was speaking about oxalates. I don't know if that's something we should really worry about, that, there's a lot in spinach and avocados and other things. Is that something we should worry about if we're still engaging in meat? Or I'm assuming that the ones that are just doing raw wouldn't have to worry about it. But what about the others?
Yeah, certainly the cleaner your diet, the better. The animal protein are really the big culprits of oxidates and gout. I mean, gout's a little bit more complex than this, oxidates. But the big worry with that is an animal protein and not so much in the plant foods.
I also had someone to say that there's a deficiency that a lot of plant-based eaters experience. Is that the case? Have you noticed that?
Well, B12 is one that people talk about mostly, but B12 is a deficiency that's fairly universal because, we don't get B12 directly from a food. It's made by gut flora. So you need to have an adequate microbiome. A lot of the foods that are grown in the soils are not, repleted. But B12 you have to supplement. Most people have to supplement, meat eaters and non-meat eaters. Largely because we're just not getting adequate B12. Similar to vitamin D, we have to supplement because a lot of people are not getting outdoor exposure. But we're a sanitized society. We're washing our hands a lot. We're using these hand sanitizers, and it has an effect on our microbiome. And if we don't have a good, healthy microbiome, we're not going to be producing B12.
Okay. I have a question about the restarting the program for the reboot, or the reboot.
The Healthy Lifestyle Series program, which is online, we run those throughout the year. If you go to that website, there's a course. Now, we are looking at doing on-site group programs. There'll probably be fewer throughout the course of the year, but there'll be Heart and Soul of a Champion programs. And that's going to be similar to the boot camp, except it's going to have everything. So it's going to have, exercise as well as the food and so on. But stay tuned for that. We're wrapping up the Heart and Soul of a Champion program, and it's going to be a much greater thriller. We'll have some retired athletes out there, everyday folks.
There was another question about a book recommendation.
Yeah, the Food Prescription for Better Health is one. That's one I read. I wrote, rather. There are a lot of good books out there, but that's my bias.
Okay, wonderful.
You can get it on Amazon.
Would this raw food help dementia and glaucoma?
So glaucoma, there's some publications showing people on the plant-based diet in general have improvement in vision and glaucoma. We see a lot of improvement in glaucoma on a regular basis. We see vision improvement on a regular basis. For dementia, it can slow or halt it. Now, you have to do some extra things like that, like ozone, infrared sauna, to really put a cap on dementia. But dementia, a lot of people, depending on how far they are, they may have some irreparable brain cell damage. But dementia is a vascular disease and a metabolic disease, and oftentimes people may have what we call cognitive decline, not so much due to organic brain damage per se, but rather due to the fact that their liver is not cleaning the blood and not metabolizing things. So as you detox, you start to
get improved cognitive function, because if you're on a lot of medicines and they're not, functioning properly and digested by the liver properly, the liver's not going to, work and digest other toxins that's in your bloodstream. And some medications lead to cognitive decline too, or associated with it. So it's a complex issue. So, but when you're eating healthy and you're able to remove a lot of medicines, you're able to do certain things to improve your body's health, then the body starts to heal itself. And so cognitive decline could be one of those healing processes.
How do you feel about the vaccine?
Well, I don't recommend the vaccine. I didn't take it. I think it's, one of these days I'll have to do a long discussion of the vaccine, but it's probably one of the most evil acts I've seen in my time of living in terms of pushing this vaccine. Just to be brutally honest, the very first, I looked at this publication at the very beginning, the New England Journal articles, and this is the publication from Pfizer and Moderna, and of course J&J published theirs, and even their data. Now you have to understand, like when these studies come out with the drug data showing the so-called efficacy of a drug, it's really publications that's controlled and sponsored by the pharmaceutical industry that stands to make money from the drug. So that's already a major conflict of interest. It's not like they create the drug and send it to somebody who's independent, let them study it, et cetera. But no, they control the data, the study, and all that. So that's number one. Number two, when these publications came out and I read them, the one thing that struck me was that these vaccines showed no survival benefit, meaning that the vaccine didn't save any lives in these studies. They looked at the placebo group and the vaccine group, and nobody died. And so that just told me that the study did not demonstrate that the vaccine saved lives. And if it didn't do that, then you may as well just throw it in the trash, because that's the only thing. If you have some experimental drug or something that's been rapidly made, you're going to want to at least show that it saves some lives. And if it doesn't save lives, then you're done. So at the very beginning, I knew that, even without thinking about it beyond that. Now, that's the bias data from the pharmaceutical agent. So then you start to say, well, is it, safe? Is it effective? No, it's not effective to save lives. That's one. Two, is it safe? Well, we don't know it's safe. Because you determine safety over a certain period of time, and they didn't have that period of time. Now what we're seeing is that it's killing people. I'm seeing people with strokes and blood clots and pulmonary emboli and all sorts of things. Young people dying in myocarditis. So now, not all of those excess deaths are just the vaccine. There are people who stayed locked up, for 2 years and stressed out and eating bad food. And that's contributing to death and all of that stuff. So it's a big mess, but the vaccine's a problem. They should take it off the market. If there's the cardiologists in the UK, I think cardiologists in the UK, from what I've heard online and read a little bit, all of those cardiologists have refused to take another booster shot. That's how they feel about it. And they're petitioning to have it taken off the market in the UK. It's only here in the United States where our politicians are bought and sold by the medical industrial complex.
I've read an article or something that said that if people that have been taking the flu shot and the booster at the same time were having stroke, there was a higher rate of stroke. Is that accurate?
I don't know that. I wouldn't be surprised if that's the case, because both of these things trigger inflammation. And when you trigger inflammation, that predisposes to blood clotting, and blood clotting can lead to a lot of problems.
Wow.
I don't recommend the flu vaccine either. I personally haven't taken a vaccine since '90. I didn't take the vaccine. I didn't wear a mask. And I've yet to be tested for COVID. I never had my nose plunged. And I work, in the medical center, and I have to get some letters and all that stuff done. Thank God I was able to get out of that nonsense, but I was ready to give up my privileges, but I wasn't going to take the vaccine.
Right. Wow. I do have a question here about the recipes. Someone is asking where they could get the recipes.
There are a variety of places. we have some online. There's some recipes in that Jumpstart. That's a good place to start. The Jumpstart. My book has some recipes. Let me put the link to my book in here. Hold on a second here. There are some recipes in the book. The book was published in 2011, and it's somewhat outdated, but it's some good stuff in it.
Now, this question is probably, I guess, kind of hard to answer, but I'm curious. Because of the docuseries that I was watching, mm-hmm. I was really disturbed and I guess surprised by was it Daryl when he came in and he seemed fit and he was still working out. He was in shape, and then we find out that his blood pressure was high.
Mm-hmm. Very high.
So yes, and for somebody in that condition to have an issue like that, I'm sure that a lot of us are walking around not realizing that there are things going on with us, and we're thinking that nothing's wrong. What would you recommend for just everybody on the call, everybody that's around, to do to prevent something like that from happening? I know visiting the doctor would be ideal, but if for those that don't go to the doctor or don't have insurance or whatever, is there something that they can do to prevent something major like that happening?
Well, you can check your blood pressure and everything, and you can, eat a plant-based diet, exercise, and just live healthy and natural. Don't poison yourself. It's not, you don't necessarily have to go to a doctor, every time, but you need to do what you need to do. And so if you're eating bad food and smoking and not getting up and moving your body, then, my goodness, at least start right there. And that can be done on, I would imagine, any budget. It doesn't cost any money to not eat bad food. If you go driving Papados and you sit there, they room you, put you at the table, say, well, I don't want a Papado platter, I don't want your etouffee, I don't want your chicken. Guess what? They won't charge you any money. Now, they may kick you out of the restaurant, but they don't charge you any money. That's the cheapest bill you have. Go to a steakhouse, say, I don't want to eat the steak. Then it won't cost you any money.
So, Dr. Montgomery, if you're going to tell us to do something every day in terms of eating and drinking, what would it be? Drink water and eat what every day?
Drink water. I would even drink a large green smoothie, and then eat hydrating fruits and greens. A big salad with hydrating fruits in it. I don't think that's absolutely necessary, but if you want to get protein powder, you want to make sure they're plant protein powder. So that's what I recommend in general.
And what with exercise? What would you recommend for exercise?
Walking is good. Push-ups, sit-ups are good. Squats are very good. Lunges are very good. Those things help build core and your quads, and jumping jacks are very good. Jumping ropes very good. Climbing hills. We don't have hills in Houston, but you can climb up the inclines of bayous. You can walk up the bayou and come down, walk and come down. Go to Tom Bass Park. They have hills. You can walk up the hills or jog up the hills. So those types of things.
And one more question.
Climb the street.
Seeded or non-seeded fruit is one question, and then what are hydrating fruits?
Don't eat any non-seeded fruits. Your fruit should be seed-bearing, according to Genesis 1:29. And then tooth decay can affect the heart. It can affect the teeth. I see that there. It can affect the heart valves. But hydrating fruits are like cucumbers. Most fruits are very hydrating, but cucumbers, watermelon, cantaloupe, honeydew melon, all those fruits are very hydrating.
Should we avoid non-seeded fruits?
Huh?
Should we avoid non-seeded fruits?
Yes, avoid them like the plague. The GMO. The watermelon should be with seeds, and you can get seeded watermelon that are organically grown. And also, just to plug some things in terms of produce, look up the Garden Kitchen. Pretty soon, in the next week or two, we will, and you can reach out to Jackie. We're going to have a system where people can order produce directly from an organic distributor that gets produce from local growers. Now, you can always go to a farmer's market, that type of thing, but you can order through them. We're going to have a link on our site in ways you can order. So we'll work with people on that if they are interested. So that way that gives you an alternative to the supermarket. And by all means, if you're able to grow your own stuff, grow your own stuff.
Dr. Montgomery.
Let me give you the link to the Garden Kitchen real quick.
Can you hear me?
Yes.
Okay, one question. What can you tell me what causes a person to lose weight when they can't find out why they're losing weight?
There are a lot of things that can contribute to weight loss. One thing people get concerned about is cancer. You know, that's one of the considerations, not the only one. But the other thing could be malabsorption, increased thyroid function. So all those things can contribute to weight loss.
Okay. All right.
Well, thank you, Dr. Montgomery. I thank you so much for being on here. I want to be mindful to your time because sometimes we can go. We go on and on. And I'm going to be respectful to your time. I thank you so much for being on here. I know you've got a busy schedule, but, you know, I feel so blessed that you actually took the time out to be on here and explain so much to us and to our community.
Well, thanks for having me. It's always a pleasure. This is my passion and my ministry, and thank you guys for doing what you do because this is an amazing program, an amazing platform, and to have so many people on the Saturday morning is very powerful. I know, you know, Sunshine would be proud of everything that's going on, so y'all keep up the good work, and whatever I can do to help, you know, please let me know.
Thank you. You actually doubled us today. The first time we ever went over 60.
Oh, wow. Well, thank you. I'm glad to be of some help. This is great. But I think...
thank you so much.
We should continue to double. I'm sure the message is always great. But yeah, the recording, and I'd like to have the recording if I have a chance to share with our community, and these are great questions, and so...
Sure. Absolutely. I'll get that to you as soon as we get off the line. And I would like to introduce another person. There's a yoga event going on today, and this goes along with the exercise. So those of you that were listening and you want to get your health on, Aset has an event going on today. Aset, would you like to explain where it is?
Actually, the event is next Saturday on April 1st. And we have opened up the Ayavra Holistic Health Center in Stafford, and we are focused on mind, body, soul, community health. So this is in direct alignment with this call today. And so on the 1st, we will be having our grand opening community event, and we will be giving away door prizes. We do have like a meditation class coming up. It's a 5-week meditation class, and that can help complement the physical changes that people are going through as they try to become healthier. And we will be giving out some raffle tickets for a free giveaway to that meditation class. We're going to have children's activities and also free classes throughout the day. If anyone is interested, they can go to our website, which is Eye of Ra Center. We have an excellent class called Spine Align, which helps people get their spine back in alignment. We also have yoga classes, and we have free yoga and meditation classes for the youth throughout the week. So everything we do for the youth will be free. We also have STEM classes that's in the works, and just a lot of great activities, coming down the pike.
Aset, can you give your website again? I'm going to type it in the chat, but it was breaking up a little bit.
Okay, sure. It's Eye of Ra Center. Perfect. And we also are working on opening up our vegan cafe. We did have a vegan cafe at the Shape Center during COVID. It was called Raw Vegan Cafe, and we did really well. So at the Holistic Center, we will also have the cafe. And we also do Reiki classes, so if people are interested in getting energy work done, we do that as well.
That's awesome. Okay, so if somebody needs to get in touch with you, is there a number that you can share?
Absolutely. The number to the center is 832-230-5245. And the event on April 1st is from 1 to 6 p.m., and it's a family event.
Wonderful. Okay, and we'll also put that in our group me chat. So anybody that's interested, I think there's already a flyer in there, but if anybody's interested, we'll post it again to remind everybody. So having said that, everyone, thank you so much, Aset, for coming on and sharing what you have going on. Thank you again, Dr. Montgomery, and everybody. You guys have an awesome weekend. Peace and love. We'll see you next week.
Thank you. Have a good time, and thanks again for having me.
Thank you.
Thank you.